Welcome to your step-by-step guide on how to self-inject with your ROACTEMRA Prefilled Syringe. Here's some important information you need to know before we start. After receiving training on the injection technique, you may self-inject, or your caregiver may administer with ROACTEMRA if your healthcare provider has determined that it is appropriate. This video does not replace training on injecting ROACTEMRA given to you by your healthcare provider. If you have not been trained, please contact your doctor or nurse to schedule a training session before using the prefilled syringe for the first time. The single-use prefilled syringe has several features to help you self-administer a preset dose of ROACTEMRA correctly. A protective needle cap covering the needle. A plunger which you press to inject your prefilled syringe. And these trigger fingers. You need to avoid pressing them so that you don't activate the needle shield too early. However, at the end of the injection, the plunger will touch these trigger fingers and release the needle shield. Each syringe has a safety feature called a needle shield that helps prevent accidental needle stick injuries by automatically covering the needle after the injection. Let's take a look at what you need to do before your injection. Keep unused syringes in the original carton in the refrigerator between 2 and 8 degrees centigrade, out of the reach and sight of children. Do not freeze. As injecting cold medicine can cause discomfort and it may be difficult to depress the plunger, remove your prefilled syringe from the refrigerator 25 to 30 minutes before taking the injection. Do not warm the prefilled syringe in any other way, for example in a microwave oven or in hot water. And do not leave the prefilled syringe to warm up in direct sunlight. Speed warming the device may destroy the medicine. Check the expiration date printed on the carton. Take a single-use prefilled syringe out of the carton by holding the middle part of the syringe. Do not use if the expiration date has passed because the medicine may not be safe to use. Do not remove the cap until you are ready to inject. Put any remaining prefilled syringes back in the refrigerator. Make sure the liquid in the prefilled syringe is clear and colourless to pale yellow. It is normal to see a small air bubble. Do not use if the liquid is the wrong colour, cloudy, contains particles, or any part of the prefilled syringe appears to be damaged. If this happens, safely dispose of the prefilled syringe in a secure, puncture-resistant disposal box, also called a sharps container, and take a new one from the refrigerator. Now place the prefilled syringe on a clean, flat surface, out of the reach of children, and wait for 25 to 30 minutes while it reaches room temperature. While waiting for the prefilled syringe to reach room temperature, make sure you have everything else. An alcohol pad, a sterile ball of cotton wool or gauze swab, a sticking plaster, a sharps container for disposing of the needle cap and used syringe once you have administered ROACTEMRA, a treatment diary and a pen or the diary app. You should always write down the date of your injection in a diary or record it in a diary app and make a note of the injection site. Before self-injecting, wash your hands thoroughly with soap and warm water and dry with a clean towel. The recommended sites to inject are the front of your thigh or your abdomen, your stomach area, except for a 5 cm or 2 inch area around your navel or belly button. The outer area of the upper arms may also be used if the injection is given by a caregiver. Do not attempt to use the upper arm area by yourself. To give your skin time to recover and prevent infection, always use a different site for each new injection, at least 3 cm or 1 inch from the last area you injected. Do not inject through clothing covering the skin or into areas that could be irritated by a belt or waistband. And do not inject into moles, scars, bruises or areas where the skin is tender, red, hard or not intact. When it comes to preparing your injection site, disinfect the site with an alcohol pad using a circular motion to clean a small area. After throwing away the pad, let the skin air dry for at least 10 seconds to reduce the chance of getting an infection. Do not fan or blow on this clean area or touch it before injecting. When you are ready to inject, Hold the needle shield firmly by the middle part of the syringe with one hand, then pull off the needle cap with the other hand. Do not hold the syringe by the green plunger while removing the needle cap, as you may accidentally pull out the plunger and waste the medicine. Throw away the needle cap in a sharps container. Never reattach the needle cap after removal, as this may cause accidental needle stick injuries and will damage the needle. You may see a drop of liquid at the end of the needle. This is normal. Do not touch the needle or let it touch any surface. Once the needle cap is removed, the injection must be started within 5 minutes, or it may be more difficult to inject as the medicine could dry out and block the needle. If the needle cap is removed for more than 5 minutes, the syringe should be disposed of in the sharps container and a new syringe should be used. When you are ready to give the injection, pick up the syringe by the middle part and hold it comfortably in one hand. Do not pull or press the plunger. Use your other hand to gently pinch a fold of loose skin around the disinfected area between thumb and index finger without squeezing. Pinching the skin is important to ensure the medication is delivered under the skin into fatty tissue but not muscle. Otherwise, the injection could be uncomfortable. Do not hold or push on the plunger while inserting the needle into the skin. The needle must be inserted all the way at an angle between 45 and 90 degrees to the surface of your skin. Insert the needle into the pinched skin with a quick, firm action. Then keep the syringe in position and let go of the pinch of skin. Slowly inject all the medicine by gently pushing the plunger all the way down without stopping. Keep an even pressure on the plunger and don't release it once you have started injecting. When the plunger is pushed all the way down, keep pressing down on it to be sure all the medicine is injected before taking the needle out of the skin at the same angle as inserted. Once the needle is removed completely from the skin, release the plunger, allowing the needle shield to extend and cover the needle. If the plunger is not fully depressed, the needle shield will not extend to cover the needle when it's removed. Do not touch the needle and carefully place the syringe in your sharps container to avoid injury with the needle. If you feel something has gone wrong with the injection, do not try to reuse the syringe or repeat the injection with another pre-filled syringe. Call your healthcare provider for help. After your injection, there may be a small amount of blood or liquid, which is normal. Press a ball of cotton wool or gauze over the injection site and hold for 10 seconds. Do not rub the injection site. If there is any further bleeding, you can apply a small sticking plaster. Your used pre-filled syringe should be discarded immediately after injection. To do this, put your used pre-filled syringe into your sharps container. Do not try to put the cap back on your syringe. If your injection is given by another person, they should also use and dispose of the pre-filled syringe with care to prevent accidental needle stick injury or infection. For your own safety and for the safety of others, never reuse the pre-filled syringe. Always keep the sharps container out of the reach of children. Make sure you dispose of the sharps container as instructed by your doctor or nurse. Write the date, time and specific part of your body where you injected yourself in your treatment diary or record it in a diary app. It may also be helpful to write any questions or concerns about the injection so you can ask your healthcare provider. It's important you feel reassured you have the confidence to self-administer correctly. And we hope this short video has shown you how the Actemra Prefilled Syringe can help you follow your treatment plan. Thank you for watching.